Marylanders over the age of 65 have been vaccinated. On Tuesday, we went into Phase 2B of our COVID-19 vaccine plan. All Marylanders aged 16 and older with underlying medical conditions or disabilities are currently eligible to be vaccinated. According to the CDC, nearly 90% of all of those hospitalized for COVID-19 have had an underlying medical condition. So getting these individuals vaccinated will go a long way toward protecting our most vulnerable citizens from the virus. The state of Maryland has now administered 2,760,176 COVID-19 vaccines, including more than 140,000 in just the past 48 hours. We're now averaging over 57,000 shots per day, which is one of the fastest rates in America. We are increasingly concerned that a number of highly transmissible variants are rapidly spreading across the country, particularly in New York, New Jersey, and throughout New England. They appear to be moving down the East Coast, now including our neighboring states of Pennsylvania and Delaware. While we continue to do better than most states, we are obviously not immune to these variants, and viruses don't recognize state borders. We're doing sequencing testing for variants at one of the highest levels in the country, and this has enabled us to identify 677 cases of COVID-19 variants in Maryland, 86% of which are the B.1.1.7 or UK variant. We also have detected at least 6 other variants, including the New York, California, South Africa, and both the B1 and the new B2 Brazilian strains. We are quite literally in a race between these variants and the vaccines. Across America, these variants are driving an increase in new infections and hospitalizations, particularly among younger people. Here in our state, we have seen an increase, primarily in Baltimore City and in Baltimore County, which is why we are continuing to take a cautious, safe, and balanced approach toward our health and economic recovery. It's also why we continue to strongly urge Marylanders to continue doing the things that have successfully kept us safe, and to do them for just a while longer, because we are not out of the woods yet. This virus is still very much with us. While some states have lifted mask mandates and all of their restrictions, our state masking order remains in full force and effect. Over the past year, all of the data and all of the science have proven that the very simple step of wearing masks continues to be the single best mitigation strategy we have to stop the spread of COVID-19. We're also continuing to advise against travel to states with high rates, and we encourage you to get tested upon your return if you do travel to one of these states. In our effort to win this race against these variants, in addition to doing as many vaccinations as quickly as we can, we're also focused on prioritizing vaccines for the most vulnerable Marylanders and those in hard-to-reach areas of the state. Earlier today, the first federal mobile vaccination units in the nation arrived at the Maryland Emergency Management Agency and headquarters in Reisterstown. In the coming days, these 32-foot trailers will be fanning out across the state together along with special FEMA strike teams to help us get more shots into arms in remote areas and zip codes that rank high on the CDC's Social Vulnerability Index. This operation builds on the mobile clinics that the state launched last month with the Maryland Vaccine Equity Task Force, which has completed or is in the process of completing nearly 100 missions. They're adding additional clinics nearly every single day, including this week at Mount Zion Church in Harford County, Sacred Heart Church in Baltimore City, and the Muslim Community Center in Silver Spring. I want to commend General Janine Burkhead and her entire team at the Maryland Vaccine Equity Task Force. Thanks to their incredible efforts engaging with community partners, we continue to see significant increases in the vaccination rate in the hard-hit zip codes, including a 108% increase in Glen Arden, where we opened a major equity task force clinic, 97% increase in Mondawmin, a focus area for our Baltimore Convention Center site, and a 163% increase in Somerset County, where we held our first mobile clinic. The Biden administration, twice this week, recognized the state of Maryland for having one of the nation's first and most advanced equity plans. In February, we asked each county to appoint a liaison to our Vaccine Equity Task Force. And in addition to that, we asked them to produce their own equity plans for their individual jurisdictions. Unfortunately, many local governments still have not done so. So the Maryland Department of Health is now requiring county health officers to immediately submit their finalized equity plans no later than Monday, April 5th. The State Health Department will also be providing each county with a targeted list of underserved zip codes and a list of specific congregate facilities in their jurisdiction, which we need them to concentrate their efforts on to ensure that they do not leave anyone in their counties behind. On Tuesday, I had another meeting with the White House Coronavirus Task Force, and as promised, this week we began to see an increased supply of vaccines from the federal government. And the White House has pledged that next week and in the weeks ahead, we should expect to see a similar supply. As a result of the robust infrastructure that we have built, our rapidly accelerating vaccination rate, and finally that critical increase in vaccine supply, we likely will be able to make announcements in the days ahead regarding further acceleration of vaccine eligibility phases. In preparation for that, effective today, we are immediately opening pre-registration to Phase 3, meaning all Marylanders age 16 and older. Let me repeat that. As of today, every single Marylander who wants a COVID-19 vaccine can now pre-register for an appointment at a mass vaccination site.
We just lost that live feed of Governor Larry Hogan's latest COVID-19 response, but it sounds like we're hearing him. But right now, he just made some news as of today. Anyone in the state of Maryland age 16 or older can pre-register to get a COVID-19 vaccine shot effective April 27. I'm understanding that we have that live feedback. Let's go back to Governor Larry Hogan.
Phase 2, but have still not yet been vaccinated will continue to be prioritized. We now have more than 3,000 points of vaccine distribution across the state, including 227 nursing homes and 1,700 assisted living facilities. We've now expanded to 320 pharmacies, more than 100 doctors' offices. We obviously have 38 hospitals and 24 health departments assisting. Last week, we announced the launch of 6 additional state mass vaccination sites for a total of 12. All of which will be open and fully operational in the next few weeks. A mass vaccination site opened in Montgomery County this week, which will transition to a higher volume state-run site. Next Wednesday, April 7th, a mass vac site will open in Prince George's County at the Greenbelt Metro Station in partnership with FEMA. This site will have the capacity to administer up to 3,000 shots per day, and will primarily serve Prince Georgians, especially those in underserved zip codes identified by the Vaccine Equity Task Force. Also next week, in addition to Montgomery County, we are opening a mass vaccination site in Baltimore County at Timonium. The following week of April 12th, we launched mass vaccination sites in Frederick County at the Frederick Community College, and in Anne Arundel County at the Navy Marine Corps Memorial Stadium. We will also open a mass vac site at Ripken Stadium in Harford County the week of April 19th. and at the Mall in Columbia in Howard County the week of April 26. In addition, beginning tomorrow, the Eastern Shore mass vaccination site in Salisbury will open a no appointment necessary walk-up line for any eligible Marylander. And our plan is to continue to add additional no appointment lines at other mass vaccination sites as well. However, we still recommend that the best way to ensure that you get a vaccine at any of our sites is to pre-register and to schedule an appointment, again, at covidvax.maryland.gov to ensure that a vaccine and an appointment is available to you. I have directed the Department of Health and the Department of Aging to immediately work with local jurisdictions on plans to reopen our senior centers across the state. Prior to these safe reopenings, closed pod vaccination clinics will be held at the senior centers across the state in coordination with local health departments and clinical partners so that we can ensure the safe return of safe indoor activities at the senior centers. In closing, this is Holy Week with many Marylanders observing Passover or preparing to celebrate Easter, two holidays that both remind us to have faith even in the darkest and most bleak of circumstances. And this past year has been one of the most difficult times that many of us have ever been through. Marylanders have made and continue to make incredible sacrifices to protect themselves, their families, and their neighbors against an enemy that has taken a heartbreaking toll on our state, on our nation, and the world. And my hope is that the people of our state will continue to have faith because we will get through this together and better days truly are ahead. With that, I'd be happy to take some questions.
Governor, J&J Emergent Plan, Baltimore ruined 15 million vaccination doses. What more can you tell us about that? When did you become aware that it does this impact rollout? And do you think it perhaps a concern that it gives Baltimore and Maryland a black eye?
Well, those are three good questions. I just became aware of it yesterday as it became public, and most of the world became aware. It was not mentioned by the White House on our Tuesday call. We, at this point, don't know the exact impact that it's going to have, although we've been led to believe from our federal partners that it's not going to directly impact our allocations, at least for the foreseeable future, and we're hoping that that's the case. I don't think it gives Baltimore a bad name. I mean, obviously there was some major screw-up at this plant with human error of some type. I don't know the details of it. I don't think you can pin that on the city of Baltimore. And I don't know exactly how it went about, but the good news is the robust program we have at the FDA is that they make sure that none of these things have been utilized and that they caught the problem before it became a bigger problem.
Governor, since your announcement of lifting restrictions on March 9th, cases and hospitalizations have gone up. New cases are basically up about 60% from your announcement. Did the state open too fast, and have you considered the possibility of reimposing some restrictions?
So we meet almost every day with our team of experts and epidemiologists, and we're following the science. We don't think it had anything to do with reopenings. As I mentioned, the worst cases right now are in New York and New England. New York has some of the strictest lockdowns, and much more things are closed there than we have here. Luckily, we're in better shape than all those states. There are, I think, 28 states that don't have any mask mandates. We're not one of them. The Biden administration, you'll notice they came out. They were somewhat critical of states that had removed mask mandates, but they didn't talk about people closing down businesses. Our indications are that these variants are much more contagious. That's why it's spreading across the country. We are better than most of the country. We're better than the region, but we're concerned about the variants. But it doesn't have anything to do with the openings.
Governor, with the expansion of vaccination, walk-ups in Salisbury, which I guess were due in part because you're not getting a lot of appointments down there. But we spoke the other day in Henrytown, you said Memorial Day. Where do you see, how fast do you see this progressing now that we move through these categories?
I think we're going to move pretty fast. And so, we now, I didn't see today's numbers. Yesterday, we had administered 99.6% or 99.4% of every vaccine that we had received. I think it was #1 in America. It's up there. We can't go any faster than that. But if they keep getting us more, we will keep giving them all to someone. That's why we've got, I think, the most robust, most dispersed plan with the 3,000 points of distribution. I don't think there's a much larger state that has 12 mass vac sites, the FEMA site. I mean, we're attacking it from all directions. I believe that as long as they can continue to provide the supply, which we're being promised, but we have no control over, that we will be able to, finish as many vaccines as we can possibly get done by the end of May.
One more thing. Dr. Redfield endured some criticism this week for comments you made on CNN about the lab and the origins of this thing. What do you think about his comments, and where do you stand with him? What do you say to those who criticize him?
Well, so I think some of the people that criticize him had not seen the comments, and they jumped to conclusions. Quite frankly, I watched the entire CNN 2-hour special and the 60 Minutes program that was before that on Sunday night. Dr. Fauci, the former head of the World Health Organization, the Biden administration, most world leaders are echoing pretty much exactly what Dr. Redfield said. He said nothing whatsoever that was inflammatory. He said it was his personal opinion. Virology in the world, running the CDC, he has much more information than I do. But for people to play politics and attack him for giving his professional opinion, which I thought he did a very good job of explaining, and everyone on CNN agreed with, Sanjay Gupta and everybody else that was on the show. Nobody thought it was in any way inflammatory. And for people, this is a very serious problem of Asian hatred and violence that I'm very much aware of, having a wife and 3 daughters and 4 grandkids. I've been one of the leaders speaking out. For them to equate him giving his professional opinion with people attacking Asians, it was outrageous and disgusting, in my opinion, political nonsense, and they should probably apologize to Dr. Redfield.
Governor, I just want to clarify one thing that was asked. Was the opening of the site in Congo, the mass vaccination site, to Walker, is that because there was trouble filling appointments there? And was there any consideration that's true of, reallocating some of those doses, or what was it?
So we allocate every single week exactly where we need to go with exactly how many we need. We've said, and you guys will go back, I said at some point it's going to change over from people saying we can't get an appointment to we're going to have too many vaccines and we're going to be looking for people. The Eastern Shore was desperately looking for a mass vac site. We opened one. We have plenty of capacity, and so we're filling that capacity with people from wherever the state without appointments, and that's all part of a plan that makes sense. But all of our mass vac sites are going to first be busy and then slow down to the point where our goal is to put ourselves out of business. Our goal is not to have huge lines at 12 mass vac sites forever. Our plan is that everybody's going to have a vaccine, like we did with people over 65. Right now, it's really slowing down because 75% of the people have been vaccinated. The other 25%, we either haven't found them or reached them, or they don't want a vaccine. So that's why we're opening faster. We're going to continue to make those decisions every day about allocations, about openings, until we can't find another person that wants one. But I think when it gets to the point where you can go to any doctor's office and any pharmacy and there are thousands of places to go, you're going to see less and less demand on all these mass vac sites. We'll keep reducing supply as needed, and if there's no need, we'll close them and move on.
Governor, when some local health jurisdiction leaders and said that the state doesn't provide them with enough guidance or heads up when moving through these vaccination phases, can you explain how the state works with these local jurisdictions when those decisions are made, and if they have any issues, how do they contact?
Our health department talks to their health officers nearly every single day. We have weekly meetings, and we inform them just as soon as decisions are made. When we announce something, that's how they get the announcement. And those things change from day to day. We're trying to get them to keep up.
Governor, part of the capacity at Salisbury is made way on all sorts of social media, listservs, Nextdoor, Facebook, and there's a lot of people and residents of DC in particular who have been planning out and driving all the way to Salisbury and
Great.
recommending to other DC residents to go get vaccinated there. What is your message to people outside of Maryland eagerly coming to these mass vac sites to take shots?
Well, first of all, I think it's great for people all over Maryland to drive to Salisbury to get vaccinated. We want to encourage far more people to do that. Like this is Easter weekend. It's a big weekend for Ocean City. I think if you haven't gotten a vaccine and you want one, I would say get in your car tomorrow, drive to the beach, stop in Salisbury, get everybody vaccinated, and then go to Ocean City and get some Thrasher's French fries, stay for the weekend, and go to an Easter brunch on Sunday morning. They are federal assets. We're required by federal law to vaccinate people. They do it. They do Marylanders in other states. We do people from other states in our state. We have no ability to change that, but the vast majority, 99% or some of our people are all Marylanders.
I'm sorry, just to clarify, are you encouraging DC residents to take it Ocean City?
No, we're encouraging all Marylanders to go. I do believe that the one we open in, the FEMA's opening in Greenbelt is going to see a lot of people from DC and Virginia, and was FEMA's intention. So it's not just going to be limited to only people in Maryland.
Thank you, Governor. I was going to kind of touch on about when you mentioned about Greenbelt. And there's been some residents who said, thank you for opening one Greenbelt where it's new and make those special people can come back. Is there any more plans? I know you don't want to open more because that means that vaccine. I mean,
Yeah.
Right. But is there maybe a plan to maybe open a few more where people can walk to for better transportation accessibility?
Yes, well, so, we're both at the M&T Stadium in Baltimore and the Convention Center site especially. We get a lot of walk-in traffic, mostly at the Convention Center. We're going into these neighborhood clinics that we're putting in churches and community centers and with our mobile vac sites. The goal is to try to reach people where they are as much as possible. Also going into the underserved communities at doctors' offices and with those pharmacies in those particular areas. So we're getting to the point where more people can walk to a vaccine because we understand the problem of not everybody has the ability to get in a car and drive. So we're going to continue to focus on that. This was FEMA's site. We provided information. They made the final decision about exactly where to locate, but we're very excited to be partnering with them. I think you saw an announcement earlier in the week where they're not going to live up to their commitment to do 100 mass vac sites across the country. I think they're going to stop about 30. We may have been the last one to get approved. We're very thankful. We're happy to have FEMA here. It's going to be another kind of tool in our arsenal to try to reach people, and I like the fact that it's on a metro stop and accessible by metro trains and buses.
Governor, you made a number of announcements regarding the expansion of eligibility and opening up pre-registration. We just entered phase 2B. One of the things that I noticed was not listed was the opening completely of phase 2. Did you contemplate that, and what prevented you from fully opening up phase 2?
So we've moved ahead of schedule on quite a bit in many regards, and I said we're going to continue to make decisions on a daily basis, that we probably will have additional announcements in the days to come. We're watching this every day, on multiple fronts. One, we hear about what we might get from the feds, but we don't know until almost like the day before. Like, for example, we did get an increase, but it's not as high as we expected. We thought it might be 90,000 more, and it was like 30,000 more because there was a little bit of a fluctuation. We got more J&J, but less of the other two. So we don't want to make decisions based on false numbers, and we also don't know the exact uptick. We know how many people are in each category, but not how fast they're going to get it. We don't want any vaccines sitting on the shelf, and we don't want to promise people they can get a vaccine if we don't have one. And so that's why we're looking at it every day. And we have and we'll continue to make adjustments, every couple of days if we need to.
Last question.
A couple of things. So you didn't get the 340. I'm curious what that number is with the 340,000. And
I think we're at 372,000. It was just that we expected close to maybe 89,000, maybe of one, and it turned out to be $30,000 net increase, 30,000 increase over last week.
so recently I had the privilege of being able to pre-register someone near me, and I got an appointment almost immediately the next day.
Right?
Is demand declining?
Yeah.
What's the correlation between declining demand and increased supply that's allowing you to move forward? And are you concerned about the declining demand?
No, I'm really excited about that because, I've been saying since January, people were all over me about nobody can get an appointment. You guys were, everybody was, I was like, we can't make an appointment for a vaccine we don't have. When the supply comes, and we've built all this, we're going to have the opposite problem. We're going to have too many vaccines, too many appointments, and not enough people. We're now getting towards that point, which is why we keep opening to larger and larger groups. But the fact that we've done 2.7 million, we're going to be, a few days, we're going to hit 3 million vaccines. That's pretty incredible. So 75% of all the people eligible that were 60, all the older people, the ones we were most concerned about, the ones that were responsible for most of our hospitalizations and most of our deaths, they're all vaccinated. So of course demand has dropped off. That 25% that's left, we have had discussions with lots of smart team members to say, are there certain people that have gotten, we don't want anybody left behind, no senior left behind, I don't want to single Maryland, so can we find, are there things we haven't done yet? Where can we go find them? Some of it is people that don't want the vaccine. Most polls say 60% of the people want the vaccine. We've got 75% already vaccinated. So, that's going to continue. We're going to look at that uptake, the demand and supply every day. We've got it, I think, exactly right so far. There are some states that are completely overloaded. They open it up too fast with no vaccines. There's other people that are, I think we've got, we're working on it from every angle. And I'm not saying we're the smartest people in the world, but we're watching it very closely, and we'll make a move one way or the other based on the facts.
Thank you.
All right, thank you.